Hematology is the study of blood and blood products. We already spoke briefly about it. Blood is made up of four main parts. The major one is red blood cells. This makes up most of the mass of the blood. It's the most plentiful cell in the body, 40 to 45% of the total blood volume. It transports oxygen. Like I was telling you guys yesterday, red blood cells, just like any other cell, are very complex. It has a nucleus, but it does not have anything else. Everything else it holds inside of it is just packed with hemoglobin. They're also shaped slightly differently to become more efficient at offloading and onloading oxygen. They're almost like imagine a burger patty if you squeezed in the centers a little bit. They're kind of a little more narrow at the center than they are at the edges. They live for about 4 months, 120 days. Then they become old. They're destroyed in the liver and spleen. Remember, the liver and spleen both help filter the blood. Hemoglobin is stored for later use. Oh, we don't produce 2.1. We produce 2.4 million red blood cells every second. I'm sorry. I've been telling you guys the wrong number this whole time. My bad. I didn't want to undersell it there. Now, white blood cells, much less numerous. They're outnumbered about 600 to 1. They defend. They're also produced in the bone marrow. They come from stem cells, like I was saying. Then there's platelets. This helps blood clot. It starts the clotting cascade process. And they also repair, again, millions of ruptured capillaries every day. Clapping your hands breaks beds. Going for a run breaks tons of capillaries. All this is happening internally in your bodies. Finally, there's plasma, which is the liquid component of blood. It's mostly water. There are a couple formed elements. The big ones here is albumin. Albumin helps transport medication around through your body. It also has limited capacity to transport oxygen and carbon dioxide. However, it's mostly used to help facilitate the transport of nutrients. Now, a little bit about blood types. Does anybody know their blood type? Go ahead and throw it in the thing. My guess is that most of you guys are going to be O positive, and I can't remember if it's A or B positive. Most people, it's about 70% of all people are those two blood types. This means that you are only able to obtain certain types of blood. Now, if you're O, you can only take type O blood. If you're AB, you can take A, B, and O blood. AB is the universal recipient. O is the universal donor, but there's a little more to it than that. There's a whole other thing going on here, which is the Rh factor. So in the 50s, we discovered this. It has always been a thing, but this is when we discovered it. Mixing blood with a different Rh factor for transfusion one time will cause the recipient to develop antibodies against the Rh factor and will precipitate a transfusion reaction if they're ever exposed again. Kind of the same as an anaphylactic reaction, right? If you're exposed to the blood with the wrong antigen or the wrong Rh factor, then the next time you're going to have a huge response, and all that blood is just going to clot and form platelets, and you're going to reject it. Most of the population has a positive Rh factor. This is only really a concern, obviously, for blood transfusions, but also when mom is pregnant with a baby. Now, mom's blood and baby's blood are separate. Baby can have a different blood type than mom. Baby's blood and mom's blood come up real close to each other to transfer oxygen, but they never intermingle, okay? Baby doesn't get any mom's blood. Mom doesn't get any baby's blood. However, when baby's being born, it's almost inevitable that some of baby's blood is going to mix with some of mom's blood. So if mom has Rh negative blood type and the baby is positive, this can cause Rh incompatibility. So it's not always going to be a problem for the first baby, but it can become a problem for any subsequent child's or any subsequent children that are born. So this is a very rare condition, and mom has to have the rare blood type that's negative, and then our baby has to be positive. But we do have medications that can facilitate this now, but it's always a concern. It's interesting that it took us until the 50s to discover this, by the way. Like, what were they thinking was happening before then? So again, most common types are O positive and A positive. And I think a bunch of you guys, yeah, we're O positive. Now, O negative is the true universal donor. I'm B positive right there, so I'm in the 10%. All right. Due to careful screening of patients prior to transfusions, reactions are rare, but they can occur. A big reason for that is the Ryan-White Act, which also helped us to understand why we're able to get infectious disease information from patients we've come in contact with. I think the story behind it was that Ryan White, when something happened to him, there was an emergency that happened to him, and he needed to go into the hospital where they had an emergency blood transfusion, and the blood that they gave him had HIV, and he contracted HIV because of a blood transfusion. Because of that, we needed to have obviously harsher standards when we're looking for blood, and then also more standards on testing the blood and also on disclosing information from one patient to the other. I think I have that story right. I might be confusing it with another one, but essentially that's a lot of the things have to happen because some sort of tragedy took place. Now, the big thing that can happen here is this thing called TRALI, which is transfusion-related acute lung injury. What happens is the plasma or the blood is transmitted. The recipient leukocytes, which are types of red blood cells, cling to the alveolar structures. The donor plasma is administered. The antibodies in the donor plasma activate the recipient's immune system. This dumps granulocyte enzymes, don't worry about what those are, into the bloodstream, increasing capillary permeability, causing acute pulmonary edema. Again, so we're going to have pulmonary edema flooding into there, that pink frothy sputum of plasma carrying with it the dead red blood cells. This will occur very quickly after the transfusion. This is why if a patient undergoes a blood transfusion, they're going to be held in the hospital for at least 12 hours, probably overnight, because this happens usually within about 6 hours. We can also have allergic reactions and febrile reactions as well, but those are rare. All right, a couple of problems that go on with the blood, which we'll talk about real quickly. There's lots of different types of anemias. Anemic literally means that our iron content is low and our blood's not healthy. It's not transferring oxygen like it should be. There's a bunch of different types of this. Aplastic would mean we just don't have enough red blood cells. Like that case we were talking about yesterday, the woman who was eating the ice, her stomach wasn't processing B12, which helps with the production of red blood cells. So she just didn't have enough red blood cells. Her hematocrit was dropping. Some of them are caused by hemolytic one, which destroys the red blood cells when they're still healthy by attaching something to them that makes the liver and the spleen think that they're unhealthy. There's not enough iron, then the hemoglobins won't be able to offload their oxygen. So even though you have enough of them, they're just holding on to oxygen and they're not doing anything with it. And then megaloblastic, where the red blood cells get too big. And when this happens, they die because the bigger a cell is, like we talked about in a human body, the bigger you are, the less likely you are to live longer. And in red blood cells, they get too big and they're undergoing more damage because they're getting squeezed through passageways that they're really not designed for. Most commonly, we think of this as sickle cell anemia or sickle cell disease. There's lots of different causes of them. Hemolytic anemia is an inherited disease that causes the ineffective use of vitamin B12. As you guys are going to see, vitamin B12 is going to pop up a bunch. Vitamin B12 is important for understanding how our body creates more red blood cells. In fact, this is why we give B12 shots to help wake people up or to give us more energy, because the idea is that a B12 shot is going to get processed in the stomach and create more red blood cells. So we're trying to raise our hematocrit slightly. And it works, by the way. This definitely works. B12 shots will raise your hematocrit. Will that realistically make you feel better? I mean, yeah, I guess a little bit. It'll make you transfer oxygen a little better, assuming that everything else in your body is working correctly. Then it will definitely have slight effects, but it's not going to be as pronounced as you would expect. There's also lots of blood disorders for the abnormal formation of red blood cells. Thalassemia is one of them. just caused by defective genes. We can recognize thalassemia by the changes it makes to the bones, especially noticeable with the face and skull. It'll widen out the cheeks and the forehead and the face, kind of flattening the nose as well. Sickle cell disease. Now we know that sickle cell primarily affects African Americans, and it primarily affects males more so than females. The reason that it affects males, or the reason it affects African Americans, has nothing to do with them being African Americans or even that they're from Africa. It came about as a way to combat malaria, a natural way to combat malaria, which, by the way, it does work as. People with sickle cell are immune to malaria. Unfortunately, they're also suffering from sickle cell, which has a lot of negative effects on the body. I guess somewhere on the evolutionary chain, the body decided that the problems associated with sickle cell were worth it compared to the problems associated with malaria, which I guess I can see where they're coming from. Now, however, we have injections and vaccines against malaria. I went and spent a year living in Peru, and part of that was I spent a week in the Amazon rainforest, and I had to get a malaria shot for that. And you guys in the military, maybe you remember Mefloquine Mondays, where they would give this shot called Mefloquine that was supposed to protect you from malaria. And my experience, I had Mefloquine shot when I was in Peru, and holy crap, it gives you some vivid, violent, crazy dreams. That's what I remember about Mefloquine. Sickle cell. The reason we call it that is because the cells are not formed. This is a normal red blood cell right there. I know it's a red on red, but these two right here are normal red blood cells. These ones are the sickles. So you can see how those can get stuck. We were on doxy and something else. And maybe it's not Mefloquine anymore. I think because chloroquine was another one that they were thinking about using, right? Remember there was a lot of talk that they thought chloroquine, which was like another one like Mefloquine, might help cure COVID. By the way, that doesn't work. They've disproved that, but there was some hope about that for a little while. I don't think we're going to have a vaccine for COVID for at least a year. I would be surprised if we had one by 2021. It's possible. I mean, with the whole world kind of focused on it, it's definitely possible, but I wouldn't bank on it. It takes a long time to approve and test vaccines appropriately. Now, the problem with this is these cells are so big, they're going to get stuck in capillary beds and cause ischemia to those tissues, which causes extreme pain. People that have sickle cell are usually taking a lot of pain medicines because this is a damaging and painful disease process. It's a chromosomal abnormality. This is the 11th chromosome that helps produce hemoglobin. So when we have acute episodes of this, it's called sickle cell crisis. Now, when it gets stuck in the hands and the capillary beds of the body, it's not necessarily going to be a true medical emergency, although it will be extremely uncomfortable for the patient. But if it gets blocked in the lungs or in the heart or in another area, then this can cause problems. In the heart and lungs, it's called acute chest syndrome. And this can cause permanent lung damage. How do we treat it? High dose O2. Right, that's really the one thing we can do. Rest and pain management is the one we can realistically expect to help it. Now, there's a couple other ones here: leukopenia, neutropenia, and polycythemia. These have to do with effects on white blood cells. Leukopenia is decrease in white blood cells. Neutropenia is decrease in the neutrophils specifically, which are the majority of white blood cells. And polycythemia is a high number of red blood cells, which causes the blood to become more viscous. It can result in a decreased environmental oxygen, or a condition that leads to low levels of O2 in the body, like COPD or smoking. Remember I talked about if you go live at elevation for like 3 months, this is going to happen, polycythemia. This is the thing Lance Armstrong used to win all those Tour de France's. Well, it's not just him that was using it, right? Like he came out and said, you know, I was using it and I beat everyone by 1 minute, and then everyone else, they weren't doing anything. They weren't using steroids. They weren't using this if they had it available. Absolutely, they all were. it actually shows us a lot of what could be utilized with things like this, right? If we have packed red blood cells, someone who is polycythemic, so realistically, if you give blood and you live at elevation, your blood will be more viscous, which might have some problems associated with it, but it'll have more red blood cells, which could have other benefits. Yeah, steroids too, obviously. I don't think there's anything wrong with people with athletes using steroids. I mean, they all are. They all are. They've gotten away from anabolic steroids because that's kind of old school and there's a lot of risks associated with it. Now they're using a lot of growth hormone or other things that I don't even know about that doctors can prescribe them. Testosterone boosters, growth hormone, things that basically like stem cell injections, things that'll just make you healthier naturally. There's a lot to it. I wish we could do more research on it because realistically we could be using that to help people that are dealing with other medical diseases, right? Not just necessarily to make us better at running the 4-minute mile, but help people that can't do it. Human growth hormone for old age. Yeah. There's actually animals that don't age. They don't age. There's some animals that if you give them certain chemicals, it will just literally turn back the clock. I think recently I was reading something about lab rats. I can't remember what the chemical that they were giving them, but it was actually restarting their human growth hormone, or not. Obviously, rats don't have human growth hormone. They have something different, but it was restarting their growth hormone and repairing damaged tissues just like it would in adolescence. It's very promising. I don't think it's out of the question that if our medical science advances, we could reach a point where we could maintain cells a lot longer. I don't know about infinitely, although there is a type of lobster, I'd have to look it up, that maybe it's not a lobster, but it's like a shellfish or a crab or something that it will just never age. The only way it will die is if something eats it. So theoretically, it could live forever. Now, I think eventually, probably within the next 100 to 200 years, we're going to see significant increases in human health and life expectancy for people that can afford it, right? Obviously, there's going to be a long time before that trickles down to, like, let's say, people living in third world countries. But if you've got like a couple $1 million, like Jeff Bezos might live a couple 100 years. Wouldn't that be wonderful? Aplastic anemia. Plastic, remember, has to do with formation of cells. Aplastic means we're not forming the cells. The decrease in red blood cell and white blood cell production in the bone marrow. Lots of things can cause this, including depletion of vitamin B12, which we were talking about. Other causes are bone cancer, autoimmune diseases, or the inability to utilize that B12. Hemophilia is a clotting disorder. There are quite a few of these. Most people have one called type A. There's a certain risk factor for this. I can't remember offhand where, like, if the mother has it and the dad is a carrier, then the kids will get it, but not if the mom doesn't have it or the dad's not a carrier. It's something like that. I can't remember offhand. I believe it's one of the quiz questions, but I can't remember offhand, to be honest. And I don't think it's covered in these slides. Finally, let's talk about DIC, disseminated intravascular coagulopathy or coagulation. Serious coagulation disorder caused by severe injury, trauma, or disease. It's initiated by some other event, starts a chain reaction response of the clotting cascade, which disrupts the normal clotting process. More likely to have multiple organ failure or multiple organ dysfunction syndrome. Myelomas. These are cancers of the bones. Remember, the osteomas are, osteon is the functional unit of the bone. Myelomas, myo usually has to do with muscles, but myeloma in this case has to do with bone cancer that causes the cellular production of the blood products. They invade flat bones, leading to pain, bone calcification, fractures, and skeletal deformities. Clumps of protein lodge in the tissue and the bone to impede circulation, also cause renal failure. Treatment includes chemotherapy, radiation, plasma exchange, bone marrow transplant.